Welcome back to We Time Convo. I'm your host, Liza, along with my very special guest co-host, filling in for Debbie, is Dawn Marie.
Today, we're having a fascinating episode lined up for you. We're diving into the world of old wives' tales, those quirky bits of wisdom passed down through generations.
Joining us are our two amazing return guests, Dr. Bovone, our queen from down under, and our gravity guru physics teacher, Marita.
Hello.
Together, we'll explore some of the most common old wives' tales, separating fact from fiction. Are they rooted in truth or just myths we've accepted over time?
Welcome back, everybody, to We Time Convo. We have medical myths today. With us, we have lovely Liza.
Hello.
Our lovely co-host today, Marita.
Thank you. Hello.
And then our lovely doctor resident here. Do you want to introduce yourself?
I'm Dr. Bovone.
Dr. Bovone is going to come hang out and make sure that our facts are accurate as possible, which is super nice because we've all heard wives' tales and medical, mishaps down the grapevine from people all over at all times. So let's just dive into this. So does chewing gum stay in your stomach if you swallow it? Because that was a wives' tale for all of our generation. I think that was told to us. And granted, gum's changed over the years, probably with the chemistry and everything.
I don't know how they got 7 years though.
I didn't even realize about the stomach acid breaking.
Well, the way our parents presented it, it was like a medical fact.
And then who was swallowing gum all the time? Who decided to do that? How often has that happened?
I don't know. I'm sure toddlers swallow gum a lot because they just don't know.
But
yeah. Or they have nowhere to put it. People don't know what to do with it. Maybe.
Yeah. Oh.
Well, a lot of people just put it like under a table and in wrong places. But maybe that's why people swallow.
I know. I'd have to say, when I started teaching, some of us are teachers here, there was way more gum stuck on things. And that was a huge thing. I had to put that in my syllabus. Like, do not take your gum out. They would stick it in.
They're not chewing gum that much these days.
No, it switched. It's funny that we brought this up. So can gum stay in your stomach?
No, it does not stay in your stomach and you get like a giant gum ball. No. So it does. It will pass through the digestive tract and then you'll just like poop it out. Yeah.
So it says here that your body, it's true that your body can't digest it, but it does run through your digestive system. So in your poop, will you just see like blue or whatever color gum?
Probably not. It probably
is. This like beets,
like corn. Like corn. Is it like corn
or beets?
I guess I haven't looked that much for it. Someone will have to do someone here go home, chew some like neon gum.
I have anecdotal evidence. I do have anecdotal. Here's a physics teacher, science person. So I'm not going to say which one of my children, but one of my kids, when we were visiting their grandparents, and they went to this candy store and bought a big old bag of like these blue gummy fish.
Oh, okay.
And my kid ate the whole thing of blue gummy fish. And this person was still in diapers at the time, but they were kind of a toddler. Yeah. And then when their poop came out, it was blue. There was blue all over.
That dye.
Yeah. So the dye just stayed there.
Yeah. So maybe not one piece of gum is going to really do anything. Maybe it's a little overload. Because I think growing up, there was way more commercials about gum, the Double Mint Twins, the gum with
Bubblicious, Hubba Bubba, all the ones. Yeah.
But that trend seems to have died out. Okay.
We should all like try different ones and see.
Oh my God. Well, we can do an experiment.
Yeah.
We can. And then
I can confirm through a personal experience that if you eat a lot of hot Cheetos, your poop will come out as one big hot Cheeto.
How much hot tweet? A lot of sharing. Give Liza a cup of coffee.
Now I don't eat hot Cheetos.
Yeah. Okay. But that makes an instant thing. We're all parents.
Yes.
Mm-hmm. Yeah.
Now seeing what comes out in your kid's diaper makes you really reflect like, oh my God. Because moments of panic too of like, all blue or something. Like, did I do any damage? So can you do any damage to your GI tract if you consume things that aren't easily broke down, or like the bag of stuff?
Probably the most dangerous would be small batteries. Like if kids were to swallow small batteries,
like the circle one.
Yeah, because they can then, if there's a few batteries, they can then erode through the cirrhosis of the bowel. That's actually very dangerous.
Okay.
So if you think that your kid swallowed a battery, that you should go to the ER.
Okay.
Yeah.
See, that's good to know.
But
because the stomach acid can break down quite a bit.
It can break down quite a bit.
But then the battery itself has chemicals in it.
Oh yeah, no that. Yeah.
So
Other things.
Yeah, batteries would be bad.
And magnets. I'm just going to say right there. Like,
yeah.
Like a lot of the refrigerator magnets, like I have these little push teeny tiny magnets. Yeah. And that's not good to go through your system because there's iron in your blood and the magnet's attracted to the iron. So.
I swallowed a dime a long time ago. Is that still in my system?
No, you probably pooped that out. Yeah.
I was like, there's some change in my belly.
And then you should probably bring in, there's always talk, I'm like an ER physician or the general surgeons, and ask for all the things that they take out of people's rectums.
Oh, I love that. Yeah. I love those shows. Because I'm like, why? At what point is that?
It's an accident. They just slipped and fell.
That's always...
They slipped and fell on the shower bottle.
Sucked it up.
Yeah. Yes.
Why do people want to stick random things?
That's a whole new other show.
That's a whole other conversation too about sexual pleasure.
All right, on to the next.
No judgment.
No. All right. Human urine heals jellyfish stings because there's a, that's
episode of Friends.
Yeah.
Episode.
Oh yeah.
Was it Joey?
I think it was Joey.
Oh no. Monica got stung.
And Joey peed on her.
Joey peed on her.
I think there's always a show where someone's getting peed on to save someone's life, and snake bites, even like stuff like that, and jellyfish. Yeah. So how accurate is that? Because there's a lot of different jellyfish out there too.
So I think you're to take out the jellyfish stingers with a tweezer. Yeah. So
you doesn't do anything.
No, it doesn't do it. It can make it fun and like lighten the situation perhaps.
No, not into that kink.
Yeah. So the Mayo Clinic recommends removing the stinger with fine tipped tweezers and soaking the affected area in hot water, or just taking a hot shower for 20-45 minutes.
So I want to take the next one because growing up as a kid, I loved drinking coffee with cream and sugar. And my mom would always tell me, you're going to stunt your growth.
How old were you when you started drinking coffee?
Maybe about 10 or 11.
Oh my God, that's young.
I did. Well, because it's like my parents would drink coffee, and if you put cream and sugar on it, it just tastes like hot chocolate.
And there was something, because you're a Bay Area kid too, like my grandparents had coffee. They brought their own creamer and sugar everywhere. So it was a very adult thing because there wasn't a Starbucks and there wasn't these, you had to go to a diner to get it, and they had different mugs. So it was a very adult, grown-up thing to do. That was part of the reason I think I was intrigued by coffee too. I was like, I get to be a little adult, have a different mug and everything.
All right.
So does it stunt your growth?
Because I'm short.
Oh, no,
you're not. I'm short too.
It does not stunt your growth. Yes, it does not stunt your growth.
Because look at all the caffeine now kids get through all the energy drinks. My goodness, that's where I'm like, I've had a former student really destroy her esophagus and stomach lining because she just overkilled with Red Bull. She caused major medical damage to herself.
So especially for our teenagers, right? What should we be telling them about like too much overconsumption of caffeine? How is that going to impact their health?
Well, I think it is a stimulant. And so I think having too much of it can be overstimulating for your nervous system. And then we don't know what else they're taking. So if you're mixing, caffeine or these other supplements, what else is in it with any other drug use or alcohol, and probably staying up too late at night and using the stimulants to stay up at night wouldn't be healthy for your overall body.
Yeah. I had another family member have to go to the ER or stay in the hospital because his heart arrhythmia got so thrown off from so much caffeine. Where they almost had to re-shock his heart to reset his SA and SV node because he was just consuming too much.
And if you have anxiety, it's not good for your anxiety.
Oh,
yeah, for sure.
I would have to say, that was more the trend of it'll stunt your growth. But like I said, no Starbucks, no Pete's, no big coffee grab and go, no
monster drinks.
And no monster drinks. When we were growing up, it was just straight sugar.
I think the big one was Jolt Cola. That was the first one of the high caffeinated drinks that came out.
Oh yeah.
In the 90s, and it was it's twice the caffeine as your regular soda.
And Mountain Dew, how nasty that stuff is actually for your system. I don't know how that has gotten past the FDA.
It's like highlighter color.
Yeah.
If you got to put something in to make it look like that, it's not good.
Yeah.
And decaf coffee actually has caffeine in it.
Oh yeah, everything
small amount.
It has a small amount, but it does.
All right. This one just for beauty experts. Plucking gray hairs will make 2 more grow in.
Oh no, it does. That is not true. Yes,
every bald man in the world would be plucking their hair regardless of hair color. If that was true, right?
Yeah, it says if anything, it could lead to infection, scarring, or even bald patches. So
you know what I heard is because I've had gray hair since I was about 12. Like every once in a while. And so now I'm old enough that I actually have white hair. But my husband was telling me that there's been some development on some gene therapy so that you can turn the gene back on to so you don't have gray hair.
I've heard too, certain magnesiums actually reverse or slow down the process of your hair turning gray. So,
I don't know about that. I'll have to look that up.
Yeah. Because I've been looking into more of the different types of magnesium and what it does because we can't produce that ourselves and we've lost it in our food source. So you have to, that would be the one supplement. And there's so many good things from magnesium, from calming,
sleep, constipation, muscle soreness.
Yes. Yeah. So, and then, with your hair color and that changing. So
don't pluck your hairs because it can, maybe cause more scarring.
Yeah.
The other thing with hair that comes up that people always ask about is like, is shaving going to make your hair grow back thicker?
Oh, I love that episode on Seinfeld. When
the answer is no, it doesn't. And so, I mean, you shave and it's like at an angle, so you might notice it more, but it doesn't make it grow back thicker or darker.
Oh, so probably what it does is you're cleaving the hair strand at an angle that creates more surface area. So then people think that it's thicker.
In a lot of Asian cultures, like they shave their baby's hair.
Yeah.
Because they think that it's going to grow back faster and fuller.
Mm-hmm. Well, I would think if it's really a baby, right, when they have their new hair growing in, taking that all off is kind of taking off the dead skin around the hair follicle. So it might look like that's happening, but that's still their progress of just their development. Because otherwise, I think all of us would just shave our head once in a while and just
just be bald. All right. So sitting too close to the TV, does it ruin your eyes?
No.
Or I guess, screens in general.
So it's not going to ruin your eyes, but as we all know, it can cause eye strain.
Yes.
And so you definitely want to be like turning away from like having some time for your eyes to relax and not be looking at the screen. And so that definitely is like a myth in that sense. The same as reading in dim light is going to ruin your eyes. Again, it's not going to ruin your eyesight, but it might cause some strain.
I have a fun fact. I have one freshman student this year and we were talking and she's like, I've already read 150 books. I have to sit up close because I've been lecturing about some to the screen. How have you read 150 books? She's like, I have to go to the doctor because my eyes are so bad now because she's just been reading so much and hasn't given herself a break. And she's just addicted to, I'm like, we're like, we're going to investigate like what book series and stuff. Like they're just novels. I just can't get enough. But she's actually caused damage. You need to stop.
Wait, she's caused damage to her eyes because she's read
so much strain.
Yeah.
Okay, so because like you can't like basically your the lens of your eye is pretty much what it is. If you think that you're having a hard time seeing, it's because you've strained the muscles and the muscles aren't going to compress or stretch your.
Yeah. So now I'm curious. I'm like, is this the book? Is this a Kindle? Like, how are you reading and everything? But she had to get glasses and for right now. And we're just like, the font too, that size and everything. But the blue light too. How about that? Because that was
blue light. Yeah, is definitely, I think, it can be like, again, more strain on your eyes. And so they'll have those like blue light glasses. I don't know like how well they work per se. It's probably better just to like take a break from the screens.
Yeah.
But everyone's jobs is looking at the screens.
Yeah.
And kids don't read a lot. I'm just kidding.
Well, this one does. Your student does.
Yeah. Don't read 150 books.
I think what they do is they're not reading the way we read growing up, and they're definitely getting information, but it's in such short spurts and they glance over stuff. So them extracting what's important material out of context is something we have to constantly refocus, because if it's not bold or highlighted or bulleted,
right.
We didn't have that as much growing up. It was like, here's the document, you highlight what's important. But now if I don't bold the words that are going to be tested on, oh my God.
Oh yeah.
So they're seeing things, maybe it is an advantage for them. It's
an advantage to those two. I mean, like I tell my own kid this, I'm like, read the questions carefully, like my students and my own personal children, because a lot of times when they come back and say, I want to see what I missed, and we went over it, it's because they're doing exactly what you're saying. They're just like looking for keywords and they're not paying attention to all the words. So they're answering a question they think is being asked, but it's not the actual question. And they go, oh, I thought it was this. I go, that's why I made it. And I have to make it bold, which is the one is not, or which, select all, or this kind of thing. So yeah,
they've had a lot more guidance to find out what information we're looking for, but they glance over quite a bit of information. They have a lot more to read too. Yeah. Like it's not, we have a library at school, but we don't use it as a library.
We don't have a librarian.
No,
we're not checking out books, and they don't have like Encyclopedia Britannica to go.
And they're not even using them.
Yeah, no, it's library is not a library. All right, so shaving makes your hair.
We did
that one. Sorry, I was thinking legs. Cracking knuckles can cause arthritis.
My husband tells my kids that all the time, and he's like, and my kids come back and say, "No, Dad, we looked it up, and that's not true."
See, myth is already busted.
That cracking
how is it
sound.
busted?
Yeah. The cracking sound is just nitrogen bubbles in the fluid that lubricates your joints. Did you guys know that?
Yeah.
I know you probably
But
knew
it's
that.
very like irritating sound. Yes.
Yes, it
is.
Yeah.
So then, like, where did this? Some of these myths, I'm like wondering, like, where did it originate from? Why would they say it causes arthritis to like crack your knuckles?
Just because I didn't want to hear the sound, maybe.
I don't know. Yeah. Or are people doing it because,
because
I don't crack my knuckles. I don't know if people do it because it hurts or if they feel something.
I feel pressure if I don't crack certain body parts. So I can't move like one of my hips likes to, or whatever, the joint. And I can move more fluid after I crack it. Now I have to be mindful. Being older, I thought that was just like, oh, this is how my body works. I'm like, oh, I need to actually stretch and work out in a certain way to have my alignment. So it's just showing my alignment out. But I mean, then chiropractors would be causing arthritis for everybody.
Yes.
Well, I just wonder because, like, you know, it says, I mean, I'm just being the scientist, nitrogen bubbles that lubricate your joints. So that then maybe you like remove the lubrication. Sorry. And so maybe that's why then like you might have a little bit of pain. I don't know. I was like, where did this come from?
And sometimes it's just fun, like a tension release thing.
Yeah.
Like I'll do stuff.
Every time my daughter comes home from college, my husband's like, I told you. it's crazy. It's a fight in the house because she does it a lot.
Yeah. All right. Eating carrots will give you better eyesight.
So I have a funny, cute story about this. When I was little, my dad would always tell me, because I hated carrots, like carrots are good for your eyes. And he said one time I picked up a carrot and I just stuck it in my eyeball.
That makes sense as a kid.
And he tells this story all the time. And I'm like, okay, Dad. And he's like, that's why you wear glasses now.
I mean, it is important for your eyesight, but it will not make it better. So there's some truth in it, but you should eat your carrots. Yes. And not put it in your eyeball.
Any food that really directs helps your eyesight?
Not that I can think of off the top as a gynecologist that I know about the eyes.
We know about the hoo-hoo. Is there any food? Well, there's a myth too. Is there food that helps your vagina stay lubricated? Is there any food that makes your vagina smell better? Because that's always an urban legend, like smoking and
Pineapple.
Pineapple? I don't even know what you're talking about.
What is your
Okay, wait, tell us.
Because your diet, what you eat, that affects.
I know, but what does pineapple have to do?
So, I heard this is for men.
Okay.
They eat
with
pineapple
semen.
and makes their semen sweeter, taste sweeter. Is that true, Dr. Bovone?
I don't know if that is true 100%, but I do know sometimes when people come in with, multiple infections and it's only like related to sex or something, we might ask about like their diet and stuff, their partner's diet.
Yeast and stuff like that too.
Yeast, a lot of women who have chronic yeast infections, they're consuming too much sugar in their diet. And a lot of the teens with like all the sugary drinks. So you're like, lay low on the sugar and trying to like recalibrate that like vaginal microbiome, which is for a healthy vagina.
Yeah. Because your vagina and your eye, correct me if I'm wrong, they're only two self-cleaning organs, which is really cool to know, but no one talks about it. Yeah. Because your vagina is lubricating itself and shedding, and then your eye with the lubrication of tears and everything else. So that's very cool. And for me, I think, sorry, I've also been teaching sex.
No, don't put like weird things in your vagina.
Yeah. Well, that was an urban myth too about douching.
Yes. Do not do that.
Which is a really good one for women's health. Like, and that. But like
wait, do or don't do?
Don't do
okay,
it.
that's
do not douche.
Like as your kids, like when you're home for the summer's
Eve.
Summer's Eve. There's all these like douche commercials on.
It was stripping the microbiome, right?
Yeah.
And that's not healthy to do. That's the thing about women's health. Like all these other urban myths and legends about like what you can do down there is like, there's a lot. Don't touch.
There's that whole aisle in any like grocery store or Target that I'm like, just avoid it. Like, you can go buy your sanitary products, but they've kind of marketed it and they're marketing more and more to like teens. Like, this will make your vagina smell better. You don't need any of that.
Yeah.
I say, don't buy any of it. The vagina has a normal odor. It's normal.
Yeah.
Obviously, if it's a fishy odor, a foul smelling odor, you have like gray, white, clumpy discharge or green discharge, come in and see us. But otherwise, don't be putting all of that stuff in.
Yeah.
Don't buy
I
it.
think that we need to find out who started men feeding, because you don't want any perfume and products down there either. That whole thing about everything has to be scented.
No. Yeah.
Throw that out the door. That one is okay. So we're moving on to other orifices.
Okay.
So I should point out back to the carrot thing. So carrots do contain beta carotene, which is a vitamin that helps maintain normal vision. So it does help, but
You would have to consume quite a bit.
Doesn't
Yeah,
give
you
you
can't just
20.
stick it in your eye.
Yeah, I know. My
It
dad
doesn't
told me.
cure your stigmatism.
Yeah.
All right. So eating other orifices in the human body. We eat 8 spiders a year in our sleep. I would think this is kind of micro, like now you've been running or something and a bug hit you in the eye or mouth. Like I would think this is kind of normal for everybody that something crawls in there and you just don't know it.
Do you guys remember that like scary, spooky story where I think I read it in a book where a spider came and went inside her little pore and laid like all the baby eggs in there, and she woke up and all the baby spiders came out of her face.
Oh yeah, I remember.
No, Liza.
Yeah. Not to scare anyone, but it just reminded me of that story.
This whole myth makes you want to go.
Yeah, it is creepy crawly. All right. So is this any truth to this one? The spiders.
Oh, the spiders. No, I don't think they're to the spiders because I think you'll be like moving around in your sleep enough. I don't think you would be.
The National Sleep Foundation says there's no hard data to support it.
Well,
I mean, I'm pretty sure maybe 1 or 2 probably sneaks in there, but it also says we also move around enough in our sleep to probably scare them off.
Yeah. Well, because they've shown people now like little spiders or something have crawled into their ear and they're like, I feel something.
Yeah.
So
I've
it
seen
can
things
happen.
in people's ears. Yeah.
Marita's like, oh
Yeah.
my God, I'm not going to sleep well tonight at all. And I sleep with my mouth open all the time. So things.
There's mouth tape now that you can have. That's a big thing. No, there is, because they're thinking you want to breathe more through your nose than your mouth. And then they're also thinking that messes with your jaw alignment and stuff, having an open jaw while you sleep.
I must admit, coming with here and talking to you guys, I'm like, I live a very sheltered life. I don't know any of this.
Oh, really? All right. Well, I think we all know this one, or heard it or said it ourselves, but the 5-second rule. And now being a parent, I can attest that's disgusting and not true.
Yeah, no, that is definitely not true. Yeah, there's like bacteria everywhere. So it's at your own risk. Yeah.
Don't eat it.
And then I have maybe a couple more, because I have a friend whose mom was she likes to say she's traditional Chinese, but we just like, I think you made stuff up. So when someone's pregnant, does it matter if you cut your hair or not? Because that was one myth. That there's a tradition that they would say like, hey, you can't cut your hair the whole entire time you're pregnant. Very concerned about being around scissors as a pregnant woman.
No, that would be a myth. You can cut your hair in pregnancy. You could dye your hair in pregnancy. Yeah.
So I have a myth. I have a pregnancy myth. Then
because there's a lot more pregnancy
things.
myths.
Yeah.
I feel like since you have that, like,
you can dye your hair in pregnancy. A lot of people ask that. Like, there's no evidence that dyeing your hair will cause a miscarriage. Having said that, I usually will tell people either they go and do it, or I say wait until after the first trimester, just because family members, if something bad happens, will blame you for dyeing your hair.
See, which
has nothing to do with it.
Yeah.
But yeah.
So when I was pregnant with both my kids, I had really, really bad heartburn. And then all of the older ladies would say, oh, heartburn means you're going to have babies with lots of hair on your head. Yeah. Well, I had really bad this is anecdotal. Both my kids, I had really bad heartburn, and they were different in different ways. And both my kids came out with full heads of hair.
Yeah.
So
same with me. Violet had a lot of hair.
She had a lot of hair. So is that?
I would say that's just probably a myth, a fun myth if it works. And if it doesn't work, then you're like, oh, well.
All right. And then when you're pregnant too, another myth that she had was you had to eat this certain soup every single day to help with your pregnancy. Is there something, because your hormones, you're in pro-grow with the HCG. Is there anything that affects the HCG growth hormone? Because that goes super high at first and then kind of tapers, or is it?
I don't think any foods are going to be affecting it.
Okay.
Yeah. So I think in within the Chinese cultural, after they give birth, they usually have a special diet for the first 30 days and things that are hot and cold, or you can't shower, all these things. So I think those are all traditions and cultural things, but I don't know if there's any like evidence to it, or there might be within like the Chinese medicine.
Okay. And then is there any food or something for someone who's breastfeeding or lactating?
Oh, yeah. Well, not really many things that you can't eat when you're breastfeeding. Even, we're okay with saying you can have alcohol, and that some people want to use those alcohol test strips. And I feel like if you're having to use those, you probably shouldn't be breastfeeding your baby.
I've used them.
Well, then if you're using them because you've had too much, and some people say like if you can find the baby, you can feed the baby.
I have a question. If you drink alcohol and you pump your milk out and you drink it again, does that consider double drinking?
So, what
the heck?
Now I'm thinking I live a sheltered life too. I'm like, oh my God. I don't know that we'd have to like do a study on that.
Okay. So how about,
but definitely like
sometimes the color changes too, depending on what you eat, right?
Yeah. What do you eat? And then like some moms who will need to go dairy free if the baby has like an allergy. So definitely the things that you're eating or spicy foods, the baby might respond differently. Because everything you're ingesting is going to potentially impact the breast milk. Okay. The other thing that's big with breastfeeding that we get all the time is that like pumping and dumping for certain things, especially if you have like an MRI or a CT and there's contrast or you have surgery, there's very few things you'd have to pump and dump for. So
you would?
No, you wouldn't have to.
Okay.
If you have surgery, when you're awake and you can bring the baby to your breast, you can breastfeed. Obviously, if you're not alert and awake, someone shouldn't put the baby to your breast. Yes, like if you are doing chemo or radiation, then yes, you should pump and dump. But for most other things, you don't have to. But that myth is still there. Because I know when people have CT scans or MRIs, they'll say, oh, you have to pump and dump for 24 hours or after surgery.
Oh, okay.
And you're like, no, you can just feed your baby when you get home.
And then,
you can also, since I'm a gynecologist, yes, you can get like mammograms when you're pregnant and breastfeeding.
Okay.
A lot of places won't do it. Obviously, if you're pregnant and there's a concern, absolutely get a mammogram because you can have diagnosis of breast cancer.
Yeah.
A lot of places will say you have to stop nursing in order to get your mammogram if you're due for it. And it just depends on people's personal preference, but you absolutely can.
Okay. And then speaking about maybe vaginal fluid and down there, if that's all right, what as women age helps increase that and keep it up?
So probably, yes, as you're aging, your estrogen levels are going to go down and there's estrogen receptors in the vagina. And so probably the number one thing would be to replace the estrogen with vaginal estrogen cream, which there's very little contraindications that you can't use that, even patients with breast cancer. I'll usually have them verify with their oncologist if they're okay using that because it's not systemically absorbed. Otherwise, there's lots of vaginal like lubricants or moisturizers that you can use, whether they're for maintenance of that tissue that you would be using 2 to 3 times a week, and then also with sexual activity of using a lubricant.
Okay. And then is there anything diet-wise that could help with the vaginal lubrication? So sometimes, caffeine might increase some discharge. There's certain things that might create more discharge. I'm thinking that's
I don't know if like caffeine would make more discharge. I mean, with the natural menstrual cycle, you're going to have like a change in your discharge because when you're ovulating, the cervical fluid will get more thin and it helps the sperm travel up into the uterus. Some of the contraceptives will thicken cervical mucus and that's how it acts as a contraceptive as well. But no foods that I know of per se. Yeah.
All right. Anything else, guys?
No. Let's see. I have these lists. Oh yeah, because this came from, I was looking at these like other groups I'm in. So people always talk about like hypoallergenic dogs, that they really don't exist.
Oh, really? So they're all
these poodles? Yeah, so dogs have skin and allergens. And so there's truly no such thing as a hypoallergenic dog. So that's just good to know. Oh, and everyone always thinks if you have like a laceration on your face, you need to have a plastic surgeon repair it. But actually the ER physicians are very adept at doing that.
Oh, that's good to know.
Don't they just glue it together?
Sometimes, depending on what it is, they might just glue it together. And then the last, I have a couple other things. Let's see, the last few things again. So this is more with OBGYN things. Pregnant people can take antidepressants. Please do not stop your medications just because you're pregnant. And then also with contraception, like antibiotics do not affect the effectiveness of contraception. So you don't need to change your contraception. Probably the only one would be rifampin, but that's for tuberculosis. So not many people are on that. Certain antidepressants or psychiatric medications can affect the contraception. And so I always still will look up and do a drug interaction check when people are on psychiatric medications for their contraception, because I might also recommend that they use condoms or switch to something different. Oh, probably the big one we get is that when everyone has a baby, they say that their low back pain is caused from their epidural, which it most likely is not true. No, it's not true. But everyone blames, we always blame anesthesia. We always like to blame anesthesia. Sorry, anesthesiologist. But it does not cause a low back pain. Probably your pregnancy and then carrying the baby and all of those changes that come along with your body.
The anesthesia just causes like your skin to itch, right?
And then probably the one big thing that that people still talk about is when a bunch of women are living together, that they all feel that their cycles synchronize, which is a myth. It does not.
Oh my God, I feel like that's so
and
true.
And there's no biological reason that would ever happen. So
it's just coincidental.
It's just coincidental.
Dinky.
Well, thank you for all of the debunking.
Thank you.
So bottom line, don't pee on yourself when a jellyfish stings you. Don't eat anything that falls on the floor. And
don't stick a carrot in your eye.
Don't stick a carrot in your eye. Thank you, Dr. Bovone and Marita and Dawn Marie.
Yay. Thank you.